Somewhere in Neolithic France, a person lay on the ground while another human being used a sharpened stone to scrape a hole into their skull. No anesthesia, no sterile tools, no understanding of germs. And yet, that patient's bones tell us they survived. Not just survived the operation, but lived for years afterward. This is the story of how ancient humans performed real, functional surgery, thousands of years before anyone knew what a nerve ending was. The procedure is called trepanation, drilling, cutting, or scraping a hole into the human skull, and it's the oldest surgical operation we have direct evidence for, going back over 7,000 years. For a long time, scientists assumed these skulls with holes in them were ritual damage done after death. Then researchers looked closer at the bone itself. Around the edges of many of these holes, they found something unmistakable: new bone growth. Smooth, rounded edges where the body had healed itself. That kind of remodeling only happens in living tissue. Dead bone doesn't heal, which meant these people weren't just cut open, they walked away afterward. And the survival numbers are staggering. A 2018 study led by Kushner, Verano, and Titelbaum, published in World Neurosurgery, analyzed around 800 trepan skulls from ancient Peru. In the earliest period, between 400 and 200 BCE, about 40% of patients survived. But in samples from 1000 to 1400 CE, survival reached as high as 91%, with an average of 75 to 83% during the Inca period. Compare that to battlefield cranial surgery during the American Civil War, over 3,000 years later, where the mortality rate was 46 to 56%. Bronze Age surgeons using stone tools were, in some periods, outperforming 19th century surgeons with metal instruments and formal medical training. How? Technique mattered enormously. The safest method archaeologists have identified is called scraping, slowly, patiently wearing away layers of bone with a sharp stone or obsidian flake, constantly checking depth to avoid puncturing the dura mater, the tough membrane protecting the brain. It was slow, it was tedious, and it was far safer than drilling straight through, because it gave the surgeon control over exactly how deep they were going, cut by cut. But technique alone doesn't explain how a person held still through this. Which brings us to the part most people get wrong. They assume ancient surgery meant screaming through raw, unmanaged pain. The evidence says otherwise. In the Andes, Incan surgeons chewed coca leaves, the plant cocaine is later derived from, and let their saliva, now rich in numbing compounds, drip directly into the incision. It's a crude form of local anesthesia, but a real one. Coca contains alkaloids that numb tissue on contact, and Incan healers seem to have understood, empirically, that this worked, even without any concept of nerve receptors. In Egypt, the Ebers Papyrus, a medical text from around 1550 BCE, documents opium-based preparations used to dull pain and induce sleep before procedures. The same papyrus even describes compressing the carotid artery in the neck to induce temporary unconsciousness, a crude but deliberate method of controlling consciousness itself, thousands of years before anyone understood what a blood vessel actually did. In India, the Sushruta Samhita, one of the oldest surgical textbooks in the world, describes using cannabis mixed with wine to sedate patients before surgery. Sushruta wasn't guessing. He wrote detailed anatomical descriptions and surgical techniques alongside these sedation methods, treating pain management as a formal part of the surgical process, not an afterthought. And it wasn't just plants. Alcohol was used widely across cultures as a sedative. Cold was used to numb tissue locally. None of this was anesthesia in the modern sense. No controlled dosing. No monitoring of vital signs. No guarantee it would work the same way twice. Patients almost certainly still felt pain, often significant pain. But the idea that ancient surgery was performed on a fully conscious, entirely unmedicated person holding perfectly still through sheer willpower, that's the misconception. Real pharmacological and psychoactive tools were in play, refined generation after generation by people who had no idea what a receptor was, only that certain leaves, certain roots, certain drinks changed what a body could tolerate. What's most striking isn't just that ancient people survived this. It's that the survival rate improved over time, which means someone, somewhere, was watching, noticing which technique caused more bleeding, noticing which patients lived and which didn't, passing that knowledge on. Trepanation wasn't static. Between 400 BCE and 1400 CE in Peru alone, outcomes more than doubled. That's not luck. That's an oral medical tradition, refined across dozens of generations, without a single written record, encoded instead directly into the hands of the people who did it. We tend to think of real medicine as starting with germ theory, with anesthesia gas, with sterile operating rooms. But long before any of that, humans were already doing something remarkable, taking a genuine, life-threatening problem, a shattered skull, bleeding under the bone, and solving it with nothing but stone, plant chemistry, and an accumulated, unwritten understanding of the human body built one patient at a time. The next time you assume ancient people were simply enduring the world, remember this. Somewhere, thousands of years ago, a person woke up from skull surgery and lived long enough for their bones to prove it.